Hello everyone and welcome to Know Your Drug, powered by MediInsights. The ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on Lorazepam tablet, exploring the various aspects of Lorazepam, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of Lorazepam tablets. Lorazepam tablets are primarily prescribed for the treatment of anxiety disorders, including generalized anxiety disorder, panic disorder, and certain types of seizure disorders. Additionally, they may be used as a short-term treatment for insomnia and as a pre-anesthetic medication to reduce anxiety and induce sedation before surgical procedures. Next, dosage of Lorazepam tablets. The dosage of Lorazepam tablets varies depending on the condition being treated, the patient's age, medical history, and response to treatment. Typically, for anxiety disorders, the initial adult dose is 2 to 3 mg per day, divided into 2 to 3 doses. For insomnia, a lower dose of 1 to 2 mg before bedtime may be prescribed. The dosage for elderly patients or those with liver or kidney impairment is usually lower to prevent adverse effects. Next, mechanism of action of Lorazepam tablets. Lorazepam belongs to the benzodiazepine class of drugs, which act on the central nervous system to produce anxiolytic, sedative hypnotic, muscle relaxant, and anticonvulsant effects. It enhances the activity of gamma-aminobutyric acid, a neurotransmitter that inhibits the excitability of neurons in the brain. By increasing GABAergic neurotransmission, Lorazepam reduces the activity of certain brain regions involved in anxiety, leading to its calming and sedative effects. Next, side effects of Lorazepam tablets. Common side effects of Lorazepam tablets include drowsiness, dizziness, weakness, confusion, blurred vision, nausea, and dry mouth. More serious side effects may include respiratory depression, paradoxical reactions, memory impairment, and dependency or addiction with prolonged use. Abrupt discontinuation of Lorazepam can also lead to withdrawal symptoms, including rebound anxiety, insomnia, tremors, and seizures. Next, important advice for using Lorazepam tablets. Lorazepam should be used cautiously, especially in elderly patients or those with a history of substance abuse or mental health disorders. Then, avoid alcohol while taking Lorazepam, as it can increase the risk of sedation and respiratory depression. Also, Lorazepam is intended for short-term use due to the risk of tolerance, dependency, and withdrawal symptoms with prolonged use. Always consult a healthcare provider before starting or discontinuing Lorazepam treatment, especially if there are concerns about its potential interactions with other medications or medical conditions. Take Lorazepam exactly as prescribed by a healthcare provider. Do not increase the dosage or frequency without medical supervision. Lorazepam can impair cognitive and motor functions, so avoid driving or operating machinery until you know how it affects you. Be vigilant for any side effects while taking Lorazepam and report them to a healthcare provider promptly. When discontinuing Lorazepam, it's important to taper the dosage gradually under medical supervision to prevent withdrawal symptoms. Store Lorazepam tablets at room temperature away from moisture, heat, and light, and keep them out of reach of children and pets. Always remember to seek medical advice if you have any questions or concerns about the use of Lorazepam tablets or any other medication. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for taking Lorazepam tablet. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.